That phrase, the cure cannot be worse than the illness, we're hearing it so much it's become something of a cliche. But the question still remains, is it? What's the answer to that question? Have governments run the numbers? Have they done the math? Not a day goes by now when there isn't a headline that discusses all of the different fallout, the consequences, the harms that are coming from the various restrictions. Last week, I was speaking to the president and CEO of Sick Kids Hospital, who told me that they have seen an unprecedented spike in admissions for eating disorders among children and teens. Wow. And he got on the phone, he called his American counterparts. He said, "Are you guys seeing this as well?" And they said, "Yeah, we are." They're now doing a systematic study into all of that to conclude what's going on here, what are the drivers from it. But you better believe that they have a hunch that the pandemic, the anxiety, the restrictions, that they have something to do with it. I got a call the other day from one doctor who said, "Man, the suicide attempts I'm seeing, the mental illness, people even asking for medically assisted dying before their time, those are going up." He's really concerned. This doctor's seeing those very things. And yet we can have these press conferences where the various public health officials and politicians, they got up to the podium, they say coronavirus numbers are rising and we got to bring in curfews and we got to shut down this and shut down that. We got to further close the walls in on people. And they can speak for a whole hour about this stuff without even mentioning those other things I talked about. So what is the answer to that question? The harms outweighing the benefits, the cure being worse than the illness. I spoke to Dr. Ari Joff. He's based in Edmonton. He did a 40-page research paper where he concluded that the harms of lockdowns are 10 times greater than their benefits. Well, I think that work should at the very least be duplicated by governments. They should start asking the same questions. They should be running those numbers to, try and check, hey, is that true? Because the experts who are running the numbers say, yeah, it certainly seems like the harms are outweighing the benefits. But to date, it seems no government has actually done that cost-benefit analysis. That is a major problem, a failure of leadership. It is a total scandal that all of the harms we're seeing in society are actually not being put together cohesively. And that basic question that I know we're tired of it, I know it's become a cliche, but it has not been answered, at least not by government officials. The experts say, yeah, we actually think the harms are outweighing all of the benefits. So people out there, they have to demand that government officials actually run these numbers a bit more and think more about the consequences, the harms, put them more in the balance of these lockdown restrictions. Is there a better way? Certainly seems like there could be, and certainly seems, based on all these reports we're hearing, that there needs to be.